Hello, everyone, and welcome on in. So, in today's video, we are going to go over the structure of blood vessels and capillaries and a little overview of their function. So, we're going to compare the structures of first arteries versus veins. They are slightly different between the two. So, they have a slightly different structure because they have slightly different pressures within them. And those different pressures lead to different needs for the structures. Then we're going to distinguish between the different types of arteries. So they're actually, it's not just a plain old artery and they're not all the same. So we're going to look at those different types of arteries. Then we're going to describe the basic structure of a capillary bed. So we're going to look at capillary beds. There are three types of capillaries. And then we'll do a general overview of the capillaries and how they work. And then we'll look at the structure of veins. So kind of working our way through the system. But first, looking at just a general difference between arteries and versus veins and the tunics. So these tunics are the different layers they have. So starting on the inside, we have what's known as the tunica intima. The intima, it's the internal layer or the one that's intimate with the blood, is another way to think of that. And what we have right on the inner lining is the endothelium. The endothelium is an epithelial tissue layer, so simple squamous tissue with a basement membrane underneath. That's just a basic membrane tissue. So that's called the endothelium. Any rupturing of that will expose collagen fibers underneath, and that will initiate blood clotting. Then there is elastic membrane. Whenever you see blue on here, it's elastic tissue, meaning it has some stretch to it. So so there's some of that in there as well, assisting in that stretch. The next layer we have is the tunica media, the middle layer, or M for muscular layer. So here we see smooth muscle found. And the smooth muscle allows vasoconstriction, where the blood vessel gets a smaller diameter, or vasodilation, where it gets a larger diameter. That becomes important in blood pressure and sending blood to where it needs to go in the body. And then the outer layer is the tunica externa. Sometimes this is referred to as the tunica adventitia layer. This is the layer of collagen fibers that give arteries and veins their structure. Also, we have out here our blood vessels. It's known as the vasa vasorum. So because they're smooth muscle, you have to also be not arteries and veins don't only deliver blood, they also need their own blood. So it's the vasculature of the arteries and veins. And I know I was talking about the artery over here, but the veins have the same three layers. Now they're not as pronounced. So veins are more flat and become more elongated. And we'll see that in the image coming up here, but they still have the endothelium. They still have smooth muscle for the most part, and then they have that vasa vasorum and connective tissue. That connective tissue also holds your vessels in place. That's why if you try to move a vessel on your arm, it moves but comes back to where it needs to be. And now, also, if we're looking at a histology image of an artery versus a vein, you can see how the vein can flatten out and have these larger lumens. So veins are known as capacitance vessels because about 65% of your body's total blood is actually stored in your veins, and arteries have a more rounded lumen. In this, you can barely see it, but there's a little pink line in there. That's the endothelium, and then right here would be the smooth muscle layers. So that would be the tunica media. This is the intima media, and then here would be the externa. So that would be the collagen fiber matrix on the outside. Now, arteries themselves come in three types. We have elastic arteries, muscular arteries, and then smaller ones called arterioles. So the elastic arteries get their name because of having elastic connective tissue. So this is dense elastic connective tissue within the smooth muscle right here. And that allows for stretch and recoil of these elastic arteries. If you look at the great vessels when they first leave the body, so the aorta and those vessels closer, those arteries closer to the heart, they when we talk about blood pressure, we say 120 over 80. Those vessels go from 120 millimeters of mercury pushing out to 80 millimeters of mercury pushing out. So they have to go through a lot of pulsatile pressure up and down. So they have a lot more elastic tissue in them to allow for that stretch in that tunica media. And then we get to the muscular arteries. The muscular arteries here are also known as the distributing arteries because they help distribute blood to where it needs to go. So it has lots of smooth muscle, hence muscular arteries. It looks like this is larger than this one, but there is a lot more smooth muscle here in proportion. So this one can go through a lot more vasoconstriction or vasodilation, changing the diameter of those arteries. So now if you decrease the diameter, you decrease flow going through there. If you increase the diameter, it's like opening up a bigger tube. It's like the difference between drinking through a regular straw and drinking through a large boba tea straw, as an example. Boba straw is a lot easier to drink through. And then we get to the arterial. These are very small. They have very small tunica intima, a very thin layer tunica media, and a thinner tunica externa. So we're getting down to the very small vessels here, but these are so small that any change, even though there's a couple smooth muscle cells here, but any constriction of this drastically reduces that diameter a lot more. So here, this one, if you restrict this one by half, yes, it changes that diameter, and that resistance increases, but not as much as going from something like this to that. You drastically increase that resistance. So these are known as resistance vessels, and these can really change the amount of blood going into the capillaries. These are very important in controlling the pressure going into the capillaries because you don't want a high volume of blood going into the capillary bed because the capillaries, as we'll talk about next, have a thin layer. So once we get to the capillaries, it's just the endothelial layer and then that basement membrane. So it's just two layers. And if you have a high pressure in there, you can rupture capillaries. And capillaries get very, very small. Most of them only allow one red blood cell to fit through at a time. So blood slows down tremendously and allows adequate exchange through those capillaries beds. So now we do have three types of capillaries: continuous, fenestrated, and sinusoidal. And they differ based on how much can move through. Now, the most abundant capillaries here are the continuous ones, so they're found in the skin and so forth. Just mainly throughout the entire body. Very, very common. So they just have this base endothelial layer, and between the cells, they have what are called intercellular clefts, and so stuff can move out via transcytosis through the cell, or they can move between these intercellular clefts. But it's a little bit more controlled. Large items like large proteins, red blood cells, they cannot move out, so they stay in there. And then the basement membrane is also continuous all the way around, hence continuous capillary, because it looks like it's one solid piece all the way through. And next up, we get fenestrated capillaries. These are found in areas where filtration is more common. So areas like the small intestines and so forth. So where your kidneys, you have a lot of filtration happening there as well. So these are called fenestrated capillaries, and it gets their name because it gets these Swiss cheese-like pores within the cells of the endothelial layer, and they're called fenestration. So here you can have stuff moving through those pores, whereas over here you did not have any pores for things to move through. Basement membrane is still completely intact here as well, but mainly you can just diffuse more items quickly through this. So areas where you're having reabsorption in kidneys or absorption in the small intestines, very important to move stuff efficiently through there. Next up, we have the sinusoids. Up until now, we couldn't really move cells or very large items in and out. These sinusoid capillaries are found in areas where red blood cells are being made. So your red bone marrow. So you have red blood cells and white blood cells entering your vasculature there, and they need larger clefts to get in. Also, where you're processing blood, so in our liver, in our spleen, macrophages can actually reach their arms in these large intercellular clefts. So here, the gaps between the cells become massive and the fenestrations become even larger, and the basement membrane is even incomplete. So pretty much very, very slow movement going through this. And so macrophages can reach in, grab items, and rip them out and destroy them. So a lot of places where blood is either made or processed is where we find these sinusoids. Another thing I didn't mention here with the continuous capillaries also help form things like the blood-brain barrier. There, the intercellular clefts are all tight junctions. There's no movement going through that. And also in the central nervous system, you also have supporting cells around here called astrocytes, which provide an additional layer that things need to diffuse through. So your brain, via this blood-brain barrier, is able to control more specifically what comes in and out. Artie, now what do these capillary beds look like and how do you control the flow rate? Well, as you move through the capillary, so here you're coming through, there's these sphincters, and these sphincters can open and close depending on what's being used. So if O2 levels are dropping and CO2 levels are increasing in this tissue, you know this tissue is going through metabolism. It's utilizing the oxygen delivering and producing more CO2 as a byproduct. And that effect actually relaxes these sphincters as this metabolic reflex and allows increased flow rate to come through these capillaries and more blood coming through, and that increases diffusion of the gases. So your heartbeat pumps blood through and that pushes things out on this end. That's called hydrostatic pressure. And then because you have proteins like albumin and red blood cells remaining on this end, the colloid osmotic pressure brings fluids back in. So that sucks fluids back in and then it sends it to the veins. Now, if you go directly through the middle, it's known as the thoroughfare channel. And then an interconnection between arteries and veins is called an arteriovenous anastomose. So those are common. You can have artery anastomosis, venous anastomoses. The veins have a lot more than arteries. But if it goes artery vein, it's called arteriovenous anastomose. But the one that goes through a capillary bed is called a thoroughfare channel. So if this tissue doesn't need anything, it'll just pass right on by or go right on through because these sphincters will be constricted. Now, veins here, not much more to add, except that veins have valves. Because veins are so low pressure, the blood would flow backwards, and you don't want that to happen. So you get these valves that prevent the backflow of blood in veins. And that becomes very important if you're sitting for a long period of time because blood begins to pull down in your calf muscles. And if you don't get up and move around and use your calf muscles as this muscular pump, you can't move that blood back up. So when you first drain from the capillary bed, you go into what's called a venule, like an arteriole, a very small vessel, very thin tunica intima, media, and externa. Very little smooth muscle is found there. But you do have the three layers, and they're there. Then in the medium-sized veins versus the large-sized veins, there's not much difference except for size and so forth in these. Now, the medium-sized veins do have more valves found in them. But they both do have smooth muscles, and these are known as capacitance vessels because of the high storage of veins. Veins can also form sinuses like the dural venous sinus, coronary sinus, and so forth, which are a larger collection area of blood. So if you're more at rest, you might store more there as well. Now, back to the calf thing where it's important to get up and move. When blood is just sitting down the leg, you could form a clot. A clot is, if it's down there in lodge, it's called a thrombus. And then if it gets up and starts moving, it's called an embolus. And then when you are coming up through, now in the next video, we will be going into all the vessels of the body. When you're coming up, you come up through the inferior vena cava and you go into the heart. And from the heart, you pump to the pulmonary circuit. We just talked about that in the last one. And you go to the lungs. So when that clot or when that embolus is moving through the system, the first small vessels it gets to are the small capillaries in your lungs. So then it will clog that one and become a pulmonary embolism, which is very dangerous. So that's why it's important to get up and move around if you're sitting for a long period of time because you don't want to encourage that clotting to occur. So that is the general overview of the structure and functions of arteries and veins and capillaries. But all of these play a very important role in regulating blood pressure because think about the equation. P1V1 equals P2V2. What this means is if I decrease the volume of something, I increase the pressure. Think about having a balloon with air or water in it. You squeeze it, you're decreasing the volume as the balloon starts pushing out through your fingers because you're increasing the pressure in that balloon. So if you cause vasoconstriction, you increase the pressure. If you cause vasodilation, you decrease the pressure. So your body is constantly regulating all of this via your sympathetic nervous system for regulating blood pressure for the most part. That's short-term regulation, is activating via these short-term signals like chemical signals and so forth. Now, long-term regulation, that involves the kidneys and the urinary system, which is a topic of discussion coming up in some future videos. But that is all I have for today. Next video, we'll be going over the vessels of the body, looking at our lab models. But that's all I have for now. If you have any questions, please let me know, and have a great rest of your day. Bye-bye.